I interviewed Alex Zajac the other day for the second exclusive hour we do on Peacock about his piece, How Bill Gates Impeded Global Access to COVID Vaccines. And we're going to be talking to Ann Newman, who's going to give us sort of a broader sense of this question. But we're starting to see the implications in various places around the world of the failure of the West, essentially, to make vaccinations and vaccines available to be produced in other countries. India right now is going through a devastating surge of COVID infections. And here is a report from Democracy Now!
Well, we should just quickly say they broke the single-day COVID case rise record.
Indeed.
Previously held by the U.S., so it's over 314,000 cases.
Yes, and this is accelerating. Here is a report from Democracy Now! Raina Ayub is outlining just how dire it's becoming in India.
It is an apocalyptic situation in India right now. It's heartbreaking not just to be a citizen of this country, but it's heartbreaking to be a journalist who is bearing witness to the events that are unfolding in India, especially with the number of COVID deaths that we are witnessing, and many of them in their early 30s. The two friends that I lost were in their mid-30s. Their families are still in the ICU. Yesterday, 22 patients lost their lives at one go in a hospital after a tank that was providing oxygen to the ventilators leaked for 30 minutes, and all 22 patients lost their lives in a span of an hour. And there is, it's like this country is breathless. On Twitter, in hospitals, whenever I'm going to report, everybody is begging for oxygen. As I'm talking, hospitals after hospitals in the national capital, not far from the Prime Minister's residence, are petitioning the High Court of the country to tell them that we have no oxygen left in our hospitals. State governments are accusing each other of oxygen theft, that they are stealing each other's oxygen tankers. It's that kind of a situation. An investigation done by a news website, Scroll, day before, suggested that the government of India had invested billions of rupees from the Prime Minister, the PM Cares Fund, for setting up 162 oxygen plants. And so far, only 33 such plants have been functional in India. So clearly, we have not learned our lessons from the pandemic last year when a lockdown was announced and there was a migrant exodus. The situation in India right now is apocalyptic because the visuals are searing. I just wrote about the story of this young woman who's in her mid-30s, who had been wanting to have a child for 17 years. She gave birth to twin daughters, and within hours she died because she was COVID positive and there was no oxygen in the hospital. So that's the level of devastation that we are seeing. Families are carrying their patients on hand carts and stretchers and carrying oxygen cylinders and begging for them on social media. And we're still talking about the privileged section, Amy. We're not even talking about rural India, from which there is so much underreporting, and we don't know how many deaths are being reported in rural India.
That's a harrowing story.
Horrible.
And account.
Horrible. And, the opportunity for these type of situations to exist throughout other parts in the world are there in large part because we as a world are not doing enough to make sure that we get vaccines out the door, or at the very least that these countries are put in a position to produce low-cost vaccinations. I mean, it really is stunning. We're going to talk more.
Well, at the very least, we're not releasing some of the stockpile, but what should be done is a patent waiver.
Well, and that's what we're going to be talking to Ann Newman about.
Exactly.
I mean, we don't have nearly enough vaccinations to make the dent, but we could easily, with one essentially decision, make it possible for the world to produce enough of those vaccinations. And we will talk to Ann Newman about that in a moment. First, we'll take a quick break, and we'll be right back.